It's 11 o'clock. Just ask the organizers, is everyone in the room or should we give it just 1 minute? Okay, well, since I think we have a lot to discuss in quite a short time, so I'm going to start the webinar.
Oh, let's wait like 1 minute for people to
Okay,
join
great.
the room. Thank you. Sorry.
No, that's makes sense. Maybe give me a sign when you think that there's a critical mass to start or when most people have had a chance to join.
Yeah, I can just unmute and let you know. I'm just watching the participant count.
Super.
And so maybe like 2 minutes. Because
Yeah,
yeah,
I
be
know it
quick.
takes a while. Yeah.
Thank you. Okay, so we can go ahead and get started whenever. I think some people will
Yeah,
still be
so,
joining, but go for it. Thank
okay,
you.
great. Well, welcome everyone to this seventh mental health dialogue in the series that is being organized by all the Horizon Europe projects that are focused on improving and safeguarding mental health in times of change. I hope across Europe that you're having as fabulous weather as we are here in Brussels, because that definitely helps mental health. And seeing so many sevens for those of us, I don't know if there are any cultures where seven isn't a lucky number, but seventh dialogue with seven projects, I think that bodes well too for our session today. Um, this session, the focus of the seventh dialogue is on dissemination beyond academic circles and into real world impact. So it brings across the perspective of the different projects on this topic of dissemination. All of the projects in this under this theme are expected to help operationalize the EU's new comprehensive approach to mental health through community-based approaches. And this means engaging at the national and EU level with policymakers, as well as a wide range of other stakeholders. For example, to get them to take up policy recommendations or new tools that are being developed or implementation guidelines. And this is, of course, a lot easier said in practice than in theory, or a lot easier said. It's an art and a science in and of itself, let alone all the other research that we're doing. So that's what we're here to discuss, this particular science and art. And this dialogue has been designed to let us come together to share insights, the challenges, the lessons learned around this topic, of how we can go beyond the academic outputs and engage non-academic audiences to create meaningful real world impact. So this means we'll discuss, for example, how all the different projects identified their dissemination priorities. It means how they engaged with a wide range of different stakeholders and how they managed competing demands across sectors and these stakeholders, because a policymaker, of course, is very different than trying to get local communities to take up, or schools, for example, or community centers to take up different practices. So participants will have the opportunity to learn from the experiences of all the different projects represented today, about what worked well, what challenges they've encountered, and what approaches they feel could be improved or explored further. And our aim is really to share this learning and to strengthen collaboration across the projects, but also the wider public health community of you, everyone who's joining us today, and to support effective and impactful, improve how we are disseminating projects, communicating projects within mental health research and beyond, to really have an impact, to have that operationalizing to succeed in that goal. So I am the program manager at ERHealthNet, and I'll be moderating the session as part of the ASP Belong Advisory Group. ERHealthNet is a partnership of publicly funded bodies or civil society organizations across the EU, nonprofit bodies that are working in public health, health promotion, and disease prevention. We're based in Brussels, and we operate at the EU policy level, at the interface of research, policy, and practice. So we also contribute to and coordinate a wide range of projects. So the topic of this webinar is really, or this dialogue is really crucial for our work too, and of ensuring that we're meeting our strategic priorities as well as the EU's strategic priorities that really benefit public health, health promotion, prevention across Europe. So as you can see from the agenda, we will start the seminar with a keynote speaker who will talk about the art and science of communicating and disseminating research outcomes beyond the scientific community. And then we have about an hour, just under an hour, for a panel discussion with the representatives of the 7 sister projects. And we'll dedicate the last 15 minutes to taking some of the questions or comments that have come up through the chat. So without much further ado, I'm very honored to introduce our fabulous keynote speaker, Dr. Pavla Hubalkova. Dr. Hubalkova is a science communicator and author who, amongst many other roles, writes for Wired in the Czech Republic and runs the science and communication show Light Bulbs. And she also runs science communication workshops for researchers. She holds a PhD in neuroscience from Charles University in the Czech Republic, was a Fulbright scholar, and received the Czech government's award for science communication in 2024. So we are very excited to have her here with us today to share more about her work. I can't think of a better keynote speaker to launch us into this discussion about the arts and science of dissemination, and to stimulate our thinking about the focus of this dialogue. Dr. Hubalkova, the floor is yours.
Thank you so much. It's my great pleasure and honor to be here. Can you see my presentation? Just double check, please. Can you see that?
We see your notes right now.
We see the poll at the moment.
Okay. And right now, is it better?
Yes.
Perfect. Thank you so much. So I would like to start with these 2 images. Do you have any ideas about what these might be? This is how I got from science to science journalism, and I really like the difference and the similarity. As you have already heard, I wanted to be a scientist. I studied clinical biochemistry and I finished my PhD in neuroscience, and I spent many hours working on this microscope and recording the weird signal. But during my Fulbright internship at Northwestern University in Chicago, I discovered professional science communication, and I realized that it's so important, and I didn't see science communication or the professional science communication in the Czech Republic, so that I decided to leave academia, the lab, and became a science communicator. I started as a writer, science journalist. By coincidence, it was the first day of the COVID pandemic in the Czech Republic, March 2020, and it really, it was kind of, it really speed up my career. And these days, right now, I'm a science communicator, I'm a science writer, I'm also a podcaster, and I think that it's a nice illustration of today's world, because it's changing with the AI and with all the information overload. We have to be multidisciplinary. If we want to reach audience, we have to be creative. And I would like to be very practical, so I will share some examples, and let's start with the topic of awareness. And I will start with the elephant in the room. Like 3 weeks ago, there were plastic elephants everywhere in Prague, like basically everywhere, and nobody knows. My social media, or the media in the Czech Republic were full of the discussion. What's that? What's the story behind? Who is behind this campaign? And after a week of Elephants Everywhere, HEDEPI, an online therapy platform, introduced and launched their new campaign. They engage with influencers talking about mental health and the importance of mental health. And then they created a campaign or the activities for the public. There were elephants, for example, at a railway station, and you could share their or your elephant in the room. They had also an online campaign. So it was everywhere. I think that Adela from the Czech Republic can confirm that it was like a huge topic in the Czech Republic. So that's one example. You have to be kind of shocking and get the attraction and hey, what's going on? The next one, it's a challenge, it's a stigma, because mental health is connected with stigma. So maybe science communication or communication about your project on social media doesn't work, because people, they don't want to follow your project on social media because they don't want to be connected. So it's really important to break this barrier or this stigma. Another campaign from the Czech Republic that takes courage. They ask influencers, and even Mr. President and his wife supported this campaign. And they ask influencers, actors, Olympionics, and they shared their mental health problems, their personal stories, or that it's important to ask for help if you need it. So ask important people for support and break the stigma. Another get the attention. Another project that I participated, or Luno. Luno is non-for-profit organization, and I was a volunteer, or I worked for them like 10 years ago. And one of their campaigns was Poops and Balls, and it was an educational campaign about the prevention of cancer. And it was kind of shocking because it was cool, it was fresh, it was focused on young generation. And we talk about cancer with kind of fun, or with the optimistic way that you can be proactive, and the prevention is really important and it can save your life. And again, it was everywhere because it was unique and different. It was different to all the other campaigns. The audience, one of the biggest problem is to reach new audience. So an example, 2 weeks ago, I organized an event about women in science, because this January I published a book called Invisible Women in Science. So I do various activities related to this topic. And 2 weeks ago, I sold out a planetarium in Brno. And they told me that it's impossible in May because of timing, like everybody is outside, or everybody is busy at school and so on. But we made it, and it's one great outcome. But the next one is that we reach and attracted really diverse audience. There were people like fan of space, like people who attend planetarium like every week, but there were also scientists, people from business, there were old people, and there were children. And the key was that I invited various or people from various groups as speakers. It was really, there were like, the first part was 1 hour interactive presentation with a lot of speakers and even with a quiz and many various activities. And in the second part, there were a lot of sites with even like chemicals, chemistry. It was really broad. And one of the feedback that I really love is from boyfriends. Like 5 boyfriends, they found my email and they sent me an email after the event, and they text me like, hey, I have to apologize. I didn't want to come, but my girlfriend forced me to attend this event. And I was surprised. It was cool. I enjoyed it and I learned a lot. Thank you for that. And please do other things. So my recommendation is to think out of the box. It was really innovative, and nobody, and they told me that it's impossible, but I asked a lot of volunteers, a lot of scientists. They participated and they shared their passion, and it was possible because it was different. So bring your topic close to people. I would like to share the example of musical festival Colors of Ostrava. It's one of the biggest musical festival in the Czech Republic, and it's really focused on music. But there is also a science stage, the big band stage, and it attracts like thousands of people per week because it's available. It's in the same place. So when you are tired of listening music, you attend a scientific lecture about mental health or about particle physics. So really bring your topic close to people and be really creative and occupy the public space, like shopping malls, railway station, even public toilets with your topic, because we are overwhelmed with social media and online campaigns. So bring your topic close to people. And of course, there are challenges. I work with many scientists and I follow a lot of scientific projects, and I try to help them with their communication. And I would like to list a few common challenges. So first one is that very often there is a great scientific project. You really do great science, but there is no communication. There is no communication strategy or no communication manager. So my recommendation is really ask or think about communication from the beginning, from the first. It's the same. Science is not finished until it's communicated. The next one is that some project communicate about itself, about that, like that they met 2 weeks ago in Brussels, or that they reached the phase 2, but it's not important for the audience. So really think about your audience and about the outcomes. The next, so it's related, there is a difference between what's important to you and your audience. So really think about your audience, and if you want to share something important for your network, for your colleagues, share it internally, not on the same platform. Another challenge is that very often mental health projects or projects, scientific projects in general, have specific acronyms, and they communicate through that acronym, and it's super hard to build the connection. And these days communication is about relationships. So so maybe find a face of your project, somebody who can explain and be really connected, because communication is about emotion and connection with people. And last but not least, very often I see no strategy and no priorities. So some project creates very expensive campaigns or produce super expensive video, but they have no audience or they have no platform. So please focus on the basic. Don't overthink it. Don't try to be perfect. Otherwise, you will do nothing. So maybe really think about the main message and the most simple way how to deliver it, and then that's enough. And even Not the best video is better than nothing. And of course, there are also a lot of opportunities these days. And the first one is that you can ask for help, ask professionals. For example, when I mentioned the Luno campaign, Boobs and Balls, we asked the best PR and marketing professionals in the Czech Republic. And they help us for free because they wanted to improve their karma, and they give us a consultation. So be brave and ask for help. There are so many great professionals that they can help you. And look around for inspiration. And I don't mean just your scientific bubble and your scientific colleagues, but really look for marketing or for maybe follow political campaigns, because they follow the latest trend. And think about, be creative, look and combine the different, for example, combine art and science. It really works. Next one, be scientist, even in communication. It means test, evaluate it, and according to that, improve your next step. The world is changing. You have to be creative and innovative. Get the attention. It's really connected. The attention span today, it's like a few microseconds. So you have to be kind of shocking at the beginning, get the attention, and then you can deliver even a complex topic. And connect with each other. Don't reinvent the wheel. Include or involve influencers, media, and participate at existing events. You don't have to organize everything. So just attend the event and have a booth or a short presentation on existing events. And if I should give you one take-home message, so imagine one specific person from your target audience. And I don't mean like the group, like policymakers or students, but really imagine one specific person, maybe a student, Anna, or a policymaker, Michael, and ask the question, what's the most important message that he or she should know? And then focus on it and skip the rest. It will be enough. And if I can help you in any way in the future, I would be very happy to stay in touch. And please keep going, because mental health is extremely important, and we need much better public awareness and better science communication and communication about these projects. So I'm looking forward to the rest of the discussion.
Thank you so much, Dr. Hubalkova, for getting this discussion off to a fabulous start with by getting our attention immediately with so many very good examples and very clear and wonderful tips and tricks. I think I will now not look at an elephant again without thinking of the elephant in the room and mental health, which is a very nice association amongst the many other examples that you sent. And also, I think what your final message too, keep it simple amongst your many messages. I think that is so important. Stick to one audience. I found it refreshing to hear that maybe it's not all about social media to get to the, get to the local settings, get to the people themselves. So much already in that one presentation that I think we can build on as we continue those discussions. And I think I can already say there'll be many demands for your presentation after this, so I'm sure that will be shared afterwards, and also for your services. So thank you for getting us off to such a great start with these examples and tips again. Okay, so now let's continue to the discussion and open it up to our panelists. So we really have a wonderful set of panelists amongst us, which with all sorts of expertise from PhD candidates, doctoral researchers, professors, communication specialists, psychiatrists, and even the CEO of a digital technology company. So I think there's really a lot we can all learn from each other. And I'll start just by posing questions to each one of you in groups of 2, specific questions. And introducing you then in that way in a bit more detail, so that we get around to everyone. And it would be great if the panelists can say a little bit about which projects they're representing, just very briefly, because that's not really the focus. And then I think many audience members may already know, but it's just good to establish the context of what you're working on. briefly before we go into the questions around how you're disseminating this. The first set of panelists are Dr. Laura Taylor, who will be representing the project ASP Belong, and Joyce Quinto representing Advance. And Dr. Taylor is professor of the School of Psychology at University College Dublin, and her research is framed by an intergroup developmental approach to study risk and resilience processes for youth in settings of conflict. And Joyce Quinto is a senior science communication specialist that works behind the scenes of science, supporting researchers in communicating and advocating their work in ways that are accessible, engaging, and meaningful in diverse communities. So I hope it's okay if I call you by your first names after introducing you. It makes it much easier for me. But Laura, we would love to hear a bit more about what you consider your most impactful dissemination strategies and why you think these were effective.
Great. So thanks so much. And especially thanks to Dr. Pavla as well. So I'm representing our project ASP Belong. So ASP stands for Augmented Social Play. So for those of you who are young enough in the room, you might remember things like Pokemon Go. It's something like that, but we like to call it Pokemon Go for good. Okay, so this is an immersive classroom-based experience. It's really about storytelling and collaborative gameplay. And again, we use the evidence from psychology to help boost young people's sense of belonging and well-being. So that's what ASP Belong is. And I'll actually pick up on one of Dr. Pavla's final points. So my role in the project is really the science of science communication. So we're really rooted in implementation science. And when we think about some of our successful dissemination strategies, it's because, exactly like you just said, I feel like I'm a very good student. We didn't reinvent the wheel. We use the ACT framework, which identifies the action, the actor, and the target in which context we want to work. So for example, we recognized we wanted to work with teachers who might implement our program in schools, parents to get them to consent for their child to take part, and then policymakers. And the behavior we were asking, the action we wanted them was to take a meeting from us. And so we used qualitative and quantitative data across our 3 implementation countries, so the UK, Czechia, and Portugal. And again, it's not perfect, but what we found from this kind of the science of it, actually running these experiments, is that teachers needed practical messages. So when we talked to them about overcoming the barrier of time, they were more likely to say they would implement our program. Whereas both for parents and for policymakers, if we talked about the specific positive benefits for young people, so like what your child would gain, they were more likely to say they would endorse it for their students or to take a meeting with us. So again, that's just one small example how the ASP Belong team is really targeting different stakeholders, thinking about what type of message works or what type of behavior change we're asking, that ultimately will get us to this like broader goal of social inclusion and well-being in adolescents, at least in the 3 settings that we're working.
Thanks so much. I think that's so interesting. And also just hearing about, the message too, keep it simple. So what do we want from policymakers? One meeting. I think that's already a lot, but it sounds very simple, but just getting there, but having that as a clear goal, I think kind of thing sounds is really interesting and useful. Joyce, from your perspective, what do you consider the most impactful dissemination strategies that you implemented, and why do you think they were effective?
All right, thank you, Ikrit. So first, actually, to answer this question, I think I want to start explaining how Advance is structured, because that's shaped our dissemination strategy from the very beginning. In Advance, actually, we have 6 teams across 6 countries evaluating 6 different mental health promotion interventions with very different populations, contexts, and languages. So there's a lot. We work with climate distressed youth in Germany. We work with socioeconomically disadvantaged youths in Lithuania, adults with migration backgrounds in Italy and Denmark, and older adults in Switzerland. And because of this diversity, we actually intentionally adopted kind of like a decentralized dissemination and communication strategy where each of our country team works very closely with our local communication units, co-creators, and trusted community networks that already understand the cultural context and have the credibility within the target populations. And at the same time, of course, we maintain an umbrella strategy at the project level to consolidate these findings and build visibility for advance. So in terms of assessing impact beyond simple reach metrics, so right now, actually, we're still in what I would call a pre-dissemination phase since the studies are ongoing. However, at this stage, we have focused on two main goals, and this is how we evaluate it. First is on building visibility around the project, so really slowly establishing an audience base for later when findings are ready. And then second is bringing in people into the study, so recruitment, and this is the main focus of the local communications teams. For recruitment, one of the biggest lessons we've learned is that actually we found that the most impactful communication strategies were not necessarily the ones with the widest reach, like TV, newspapers, social media, but the ones that are actually grounded in trust and existing relationships. Because across the 6 countries that we have, we observed that the recruitment worked best through organizations where the target groups already had established trust, and in some cases where people already felt emotionally connected to the topic. For example, we work with Fridays for Futures, where climate involved youth are part of in Germany. And we also found that in-person engagement matters a lot. So we get more people to join the research when they directly meet their researchers, because it really helps in creating familiarity and trust in the project. And then on the other side, for broader visibility and credibility building of the project as a whole, our target is really towards research and policy influence. So I would say the combination of different online and offline engagement have been working. And just to say and to give an example of an early policy impact, is actually organizing the first mental health dialogues in 2024, which we co-organized with Mental Health Europe, who we know organizes the annual European Mental Health Week. And that organization really helped us gather a lot of participants, and the insights from that dialogue, both from the panel and the participants, we were told were later taken up as inputs to the 25-27 Horizon Europe program. And I think from there was really good to have the visibility, at least within the EU policy researchers and comms, and also props to all the sister projects, because we are all part of that dialogues. So overall, I think our biggest takeaway has been that the most effective dissemination strategies were not broad mass communication campaigns, at least now in this phase of the project, but really having that trusted, relational, and community embedded approaches.
So much in there too, and then that final point, you summarized it so well for me, what you said, that sometimes you think, oh, you just have to reach the world, but make it be effective in the communities that you need to, and amongst the people that you want to. And then also, at EU level, there are also platforms that can help disseminate, like as we're doing now, information. Thanks so much. Let's move on to our second question and second set of panelists. So I'd like to turn to Sofia Vetturini, representing Bootstrap, and Rainer Mere, representing MentBest. So Sophia is a PhD student at the University of Hertfordshire, and her background focuses on neuroscience, with a strong interdisciplinary focus on addiction. And Rainer is a doctoral teacher at Tallinn University and junior researcher and project manager at the Estonian Swedish Mental Health and Suicidology Institute. And his doctoral research focuses on implementation science, specifically the process evaluation of multi-level community mental health interventions across European countries. And my question to you is that for your projects to have real impact, you need to reach quite different stakeholder groups, from the people you work with on the ground to policymakers and professionals, as we heard already from the last panelist. But how have you tried to balance broad visibility within your project with deeper engagement of those stakeholders who are most critical to uptake and real world impact? So in other words, what has guided your decisions about which stakeholders to prioritize in your communication and dissemination plans, and where any audiences that you decided to, or were there audiences that you decided not to target at all? So I think that links nicely with what the previous panelists were saying, with such a wide diversity of stakeholders. So maybe Sophia, you could.
Thank you very much, Ingrid. So yeah, I'm Sophia. I'm a PhD student at the University of Herefordshire. I have a research master in drug development and neurohealth. And then I started focusing a bit more on the addiction topics, although I'm now also a little bit more involved with substance use disorders and how social media can amplify this. We've worked a lot also with ethnographic analysis, where we actually analyze also how these communities interact within each other. And yeah, then that also then led to working more tightly on PUI. So maybe just one word about the project. So Bootstrap is focused on problematic use of internet among individuals between 12 and 16 years old. So we're talking about teenagers. And the central intervention coming out of this project is a purpose-built app to help these young people reduce problematic use of internet, or PUI, with recruitment through schools, and where we really try to reach to both students and academics. And in terms of disseminations and which are the groups that we try to prioritize or that we had to deprioritize, I would say that in general, we try to have quite a broad reach. So our main vehicle are podcasts, and we are actually doing very well with those. We have a bunch of different topics that we've been covering, ranging from PUI to also more maybe to other conditions. But what really is important for us is that with podcasts, we're able to not only reach the general population, but also very importantly, the students, because the students are actually the main listeners that we have. We can also very importantly reach the people that may be affected by that specific condition, which for us is also a really, really important point, because these are also the people that need to know about it. They need to know there is interest around this. And so this is definitely the main vehicle that we've been using, but we've also been involved in the creation of public health campaigns. The most successful one and most recent is the 100% Me campaign, where we've worked together with academics, scientists, and artists to create really just a campaign to prevent against the harmful use of social media and problematic use of internet. And we've actually seen a great success with these type of events, because even though we try to appeal to a part of the population that maybe was a little bit more targeted, but this is actually where we have seen a lot of public engagement as well. And we also had the Ministry of Italian Health that came to the campaign. So, and I think this also really ties in nicely with what was being said before, that often the most successful dissemination activities are the ones that are more targeted. And I think this for us is also really a case study to show how and why this actually worked. And it really is that when you are targeting it more to specific audiences, the people that are there because they are actually engaged with the topic that you are trying to bring forward. And to then take this on a, let's say, more policy-making level, we also have a lot of parliamentary engagement. So we have an all-party parliamentary group on online behavioral trends. And these are, of course, the type of relationships that are more effortly to maintain and that really do just require a lot of engagement, but it's also the type of relationships that help you bring forward, or to at least to a very different level, certain topics. We've had the opportunity to present original research in front of parliamentarians, and this is really a way in which these type of dialogues can actually be embedded a little bit more into these public health talks. And so I will just actually end this with a bit of a reflection also on my role as an early career on the project. And I really would like to say that being involved in such type of projects from an early age, I would say, it's incredibly formative, because in the end, publishing a paper can remain a bit more end to itself, let's say, or at least much more confined within the academic circles. But real science actually happens outside of it. If you're not able to talk about science to the people who need to listen about it, then the science that you've been working on is probably not so useful as we think it is. So yeah, just really happy also to have had a role on these projects.
Thanks, Sophia. That's such an important core message. I just had one clarification in terms of the public health campaign. Was it an online campaign or was it also in the communities that you're working on?
No, what we did, we realized different videos in collaboration with these artists, and then yeah, it was an online campaign, but then we had the actual launch within a theater with a very, very nice event in Italy.
Yeah. So also moving away from online again, it's refreshing as examples. Yeah, thank you. And Rainer, would you like to reflect on this? Again, the question of how you reach different stakeholders, what's most effective in the context of the MentBest project.
Yeah, thank you. And thank you for rewording the question because I honestly forgot it. So that's really useful. So yeah, MentBest is the project's name, and it basically uses a 4-level intervention model, which basically means that it covers quite a few distant fields, covering primary care training, public awareness campaigns. We work with gatekeepers and we educate them. And basically, we have a digital self-help tool. So the aim is to decrease suicidal behavior and to support people who suffer from depression to get the help that they need, right? So when the keynote speaker mentioned stigma, so that's a big piece of our work as well. But we do work on many levels simultaneously because the research has shown that we have done so far over the years is that you have to work on all of those levels at the same time, because then you get a synergistic effect, which then implements and kind of increases the effect of the implementation in general. But so in a sense, like the structure itself segments the audience for us. But here in Estonia, where I do the implementation and where I coordinate the activities, the interesting lesson I would say was that the uptake didn't follow really our assumptions. Well, not at all, but it had its own issues. So basically when I started, I invested quite a bit of effort into reaching schools, for instance, because, well, you have schools, you have kids. The kids suffer tremendously from mental health issues, including depression and suicidal behavior. Surprisingly, they were really unresponsive. So basically all of the schools in the intervention regions, not all, but like 3 of them responded positively. Others maybe didn't respond at all. So it got me thinking, what's happening there? Well, turns out that they already have tons of offers and they were overwhelmed with all kinds of offers already. So there's saturation in some of those fields, but we did reach a part of them. Kindergartens, for instance, they were very interested. They genuinely wanted to be a part of this. Engagement was immediate. So basically what happened was I kind of outlined an activity and plan, but I had to be very agile and see what works and what didn't. So just to bring out one, maybe like a huge win, you could say, but also goes well with what the keynote speaker mentioned, was find something interesting. If you try to reach the audience, try to find something genuinely interesting. So what we did was, when we talk about gatekeepers, we trained hairdressers and barbers to be gatekeepers, right? So for them to be able to spot people who have issues with either depression or mental health issues or suicidal behavior, and not to start, some kind of a therapeutic process, but to kind of, direct them to the support that they needed. National TV, radio, press immediately picked this up. They were very interested in it. This blew up immediately all over the country. So, you have to be very creative. You have to be quite diligent, but also very agile. So if your plan doesn't work out as you thought it should, then you have to kind of make some of those changes and just go with the flow, basically. Yeah, to me, that's what real dissemination looks like. Be available and be ready to adapt.
Yeah, I think that's a core message too that's coming across through different presentations about the need to also grasp interest where it is. And then I think your example about hairdressers is also really interesting, and that also can segment into the next question. We'll see, but learning also from what doesn't work, but then moving into then what does. So as you say, the flexibility is important. Sounds like it's very important element in dissemination. Creativity, flexibility in what we're doing. Thank you. Really good insights. Okay, and moving along to our next panelists, I would like to introduce Dr. Habib Nasser, representing the SMILE project, and go back to Dr. Joyce Quinto from Advance. And Dr. Nasser is the CEO of and co-founder of the RDIUP, READUP. Maybe you can say the name. I don't know if that's an acronym or not, but a company specializing in the development of digital technologies, where he leads a dynamic team addressing emerging challenges in rapidly evolving societies. So his work is driven by a vision to push the boundaries of AI and data analytics, with a particular focus on applications in energy, e-mobility, and the healthcare sector. To both of you, I'd like to ask a bit as we heard later, from the previous speaker, from Rainer, we often learn as much from what doesn't work as from what does. So looking back at your communication and dissemination efforts, what has not worked as you had hoped, and what do you think were the main reasons? Maybe Habib.
Yes, thank you everyone. Thank you, Ingrid, and all panelists. So I am CEO at RDIUP. We are based in France, and I am representing SMILE project. So in SMILE project, we are RDIUP is leading the dissemination communication work package, and we are providing a mobile coupon app in order to collect data from participants and end users. So briefly, SMILE aims to develop digital toolbox in order to address mental health in use, such as CBT-based gamification, XDSS, and our Copen app mobile. So these tools allow to, we can say, tailored care plan to assess their moods, their behavior, teaching them coping skills, and increasing their resilience. So all these tools are already under testing in 7 European countries. In order to answer your question, maybe I can, in few words, start about what is working effectively. So in our dissemination communication, so we are very active in social media, and we can say we are producing with creative short and animated video in order to disseminate our outcomes, and all these materials are translated into the 7 pilot language. So as I said, so almost of our target or goals are achieved, but one of key lessons learned to be shared is that communication or dissemination of the cares, the key exploitable results and project outcomes did not have enough time to fully generate the level of impact that initially expected. So for various reasons. For example, here we have a huge number of pilots, and we made a common decision in order to focus mostly our effort or resources on implementing these pilots, and especially focusing on engaging local stakeholders. So as it is the central, we can say, action activity to validate the project approach, and as consequence of the communication dissemination activity around the care started a bit later than they ideally should have. And maybe if I look back, I can also realize that the co-ownership and the IPR of these related cares should have been clarified much earlier also with the consortium, because in some cases, delays in defining these transparent exploitation pathways, co-ownership can create an unforeseen coordination that slowed down dissemination effort. I think also that this is something that happens quite often in collaborative EU project. We have various partners with different fields of feedback, background and context. And another important point that we often underestimate a bit the allocated time and the resources for the dissemination of cares. And because, for example, in SMILE, we have optimized even the DC reporting process, and we reduced the monitoring effort because we developed a tailored or unique tools called EU trackers that allow, facilitate, accelerate in a smooth and effective way the DC or dissemination and reporting. And but we have observed that dissemination efforts are not always balanced among partners because some organizations naturally they have stronger dissemination capacity and have large networks. So maybe what I can recommend here based on our experience that dissemination of cares should not be treated as something secondary, should be fairly estimated and has to be activated from the beginning. I think.
I think, as you say, the issues around time are common to in many projects and coordinating that, and also the importance of allocating sufficiently, as we're discussing throughout the seminar, to communication and dissemination processes. Okay, and Joyce, maybe quickly, if you'd like to add anything in relation to the advanced project.
Yes, I'll try to be very brief. So just at least talking about the communication in terms of encouraging people to participate into the project. I think one of our clearest lessons that we're learning right now is actually, and we've all touched upon this already, was that the more passive or broad communication approaches generally did not work as well as expected. For example, in Switzerland, we had newspaper advertisements, and it had almost no impact to recruitment. And we suspect that it's because visibility alone was not enough, especially for older adults, for example, where we think for them that it's more important that there's trust and personal connection than just simply seeing an advertisement. And it's kind of the same in Lithuania, where we had posters everywhere and we had like outreach emails. And we found that this much less effective because it relied on others forwarding the information, and then that the teams have much less control on where it lands. But also perhaps there's also some design issues why it didn't work. The team in Lithuania actually also collaborated with an influencer, which may have helped in raising awareness, which is also one of our goals, but it did not substantially increase recruitment conversion. So that was some important lessons for us, which is like broader visibility does not automatically translate into participation. So I think in general, in many of our contexts in the project where mental health stigma is also strong, that communication needed to be a bit more, direct, sensitive, and relationship based. So if we were to adapt our approach in future projects, I think we would really invest from the very beginning on really trusted community partnerships, focus less on one-way dissemination, although it's also very important. So we are still doing it, but really, as Habib also mentioned, that putting in a lot of resources and time and efforts into more heavily direct human engagement. So that's just very briefly our learnings.
Thank you. Yeah, I think that word trust you might not necessarily associate with communication dissemination, but it does seem to be very important, especially to that getting that local engagement. Yeah. Okay, then we will move on to our next panelists. There are still some panelists who haven't spoken yet. Faith Thompson, representing Improva, and we'll also in this for this question go back to Sofia Venturini from Bootstrap briefly. But Faith works at the Trinbos Institute, a Dutch knowledge institute on mental health. Her work centers on translating complex mental health concepts and frameworks into clear, practical outputs for policymakers and other key stakeholders. So it sounds like your work is very much specialized in what we're discussing here. Thinking about your most successful dissemination efforts, what do you think has made them most effective? maybe
Okay, morning everyone. Just a quick recap on what Improve It is. So Improve It is an e-health intervention platform that focuses on prevention and early detection and is implemented through schools. The pilot's taking place in Spain, France, Germany, and Romania. And along with my team at Trimbos, we focus on sustainability and scale up. So we're thinking about the future and who's needed in order to make sustainability and scale up happen. We have a number of deliverables that include policy briefs. So we're hoping to reach policymakers, as well as developing a roadmap that contains what's needed in order to scale up the Improve It intervention. In order to get the information for these deliverables and to bring them into the context of the different intervention locations, we've done 6 policy roundtables, and policy roundtables include policymakers, but also youth and also teachers, so the people who are needed in order for scale up. And when you say what's needed for a successful dissemination, for us, success is a bit difficult to think about at the moment, because for us, success will be scale up. But in terms of what makes a successful policy roundtable, so that in the future, the people who came to these policy roundtables are engaged, etc., is really ensuring that they take ownership over the intervention that's being discussed. So we've just heard this from our previous speakers also. The policy roundtable is set up to involve the participants in a way where they can see themselves in the story of scale up. And I would say that our policy roundtables can be considered successful because at the end of the roundtable, in one of the countries, for example, the students that attended really were placing themselves in the story of scale up. So they were saying, hey, why don't we go and lobby at the local municipality to see if we can get some funding for future scale up of the project? Or, hey, what about if we share it on our engagement channels? So they are representatives of student association. They said, oh, we would love to share it on our channels, etc. So I think, although it's a bit early to say if it's going to be successful in terms of scale up in the future after the project ends, I think a good way of saying that we've been successful so far is that the participants were able to place themselves in the story of the intervention and understand what is needed from them and what's also needed in the future.
Thanks. And thanks so much for highlighting. I don't think we've mentioned policy roundtables or roundtables in general yet, but I do think they're incredibly effective tools to generate that kind of engagement. So great that you highlight that. We haven't yet. And Sophia, very briefly, from your side, also on which regarding the most also successful dissemination act, what you think made your dissemination efforts more successful. So you've already discussed some of that, but any, as you're listening to others?
I would say that for us, the most successful dissemination work has definitely been the parliamentary engagement, because, if we want to see change, that's not going to happen if we just keep referring between academics. Change happens when you actually manage to engage with the public, the people that are affected by the conditions, the clinicians, and the people that have to regulate what happens around those conditions. And that's really, I think, why I think we managed to be successful with this, because instead of finding some information and then going forward to the politicians and saying, please talk about that, we really tried to create a forum together. We were building an agenda together. The events are co-organized. The topics are decided in combination. The speakers are also decided in that way. And I think when you manage to have these type of activities in such a sustained way, it has a completely different impact than a one-timer where a group of researchers goes and tries to bring forward a certain topic. And, in this way, what we've really seen is that now we have an all-party parliamentary group where it wasn't existing before. And it's partly also because we were lucky in terms of timings, because now there is a lot of interest around these online behaviors and especially online harms. So we actually also were, just a little bit lucky with this. But as I was also mentioning, then the main counterpoint is that these type of engagements, they do require a lot of time, resources, and just work on it to keep maintaining it. But from what I've been seeing, if I can say, it's completely worth it. And I really agree with Joy's point that dissemination has to be targeted.
Yeah. So again, the emphasis for the Parliament. So I think in this context, really important to emphasize that at different levels, so EU level, but also probably local, national level, and the time invested in these things is an important part of a project. I'm going to skip one of the sessions because there's a panelist we haven't heard from yet. So certainly not last but not least in terms of introducing the panelists is Dr. Naeem Fanai from the Reconnected project, and maybe I can also bring in Faith Thompson again from Improva for this particular question. But Dr. Naeem Fanai is a physician, a psychiatrist, and an associate professor at Alma Mater Europea, which is an international university based in Slovenia. And in addition to his academic and clinical roles, he has acted as a local consultant for the Council of Europe on persons deprived of liberty, and he has engaged extensively in working groups at the Ministry of Health, for example, and on mental health law and clinical guidance. So my question to you is that I think, as has been mentioned by one of our panelists, that often we're asked, there are issues of timing, we're asked to communicate long before that we have really final results, as Habib has also highlighted. And in that context, what approaches have you found most effective for talking about work in progress without overstating impact? And how have you adapted your communication strategies in situations where, with these kinds of situations where outputs or trial findings are still emerging and not ready to be fully shared?
Hi.
Hello.
Thank you for being as panelist here. I represent the project Reconnected, which is one project of 11 partners, and which aims to address the mental health challenges in Europe by vulnerable populations, such as youth, migrants, elderly, or people with low socioeconomic status. Regarding your question, we might say that in Reconnected project, to effectively communicate work in progress without overstepping impact, the most active, effective approach is to share responsibly foundational and intermediate results. Rather than waiting exclusively for final peer review publication, the project actively publish short web articles, blog posts, targeted newsletters for interested parties, and partner interviews to share preliminary findings and the active components of the research as they happen. In these situations where the trial-related findings or final outputs are still emerging, strategies have been adapted to focus on communication the outcomes of earlier project phases, such as results of participatory workshops with stakeholders, also conceptual frameworks, stakeholder needs. The early outputs also serve as valuable key exploitable results. So we now are clearly prioritizing our key exploitable results based on their degree of innovation, exploitability, and impact. Also, we using strategies which rely on open science practice, such as pre-registering the study protocols and platforms like Open Science Framework to be available for people interested in this.
Wonderful. So it sounds like it's really focused. If there's a lack, if you have to communicate before you have results, it's really looking at what's most exploitable, where to focus your attention on. Faith, maybe very shortly on this particular question, and just I'm now conscious of time, so making sure we have some time for a full panel discussion to bring you all in.
Sure. I think in full transparency, anyone who's worked with policymakers knows that they will ask for trial results. They want numbers, they want something easy to read because perhaps they don't have all day to read a 30-page document about a particular intervention or approach. From the improver side, for example, when we did the first round of policy roundtables, we didn't have a trial data to share. But I think there, and definitely in the world of prevention, there's not always a clear story, number story that can be told. So I think there's more to an intervention generally than just the trial data. So if you take Improver, for example, it was created in a co-created way. We've got the network of all of the different countries and institutions coming together to trial the pilots. There's a lot of, we're living in a world of digitalization and of the need for youth involvement in interventions, etc. There's more to the story than just the trial. So I think when we didn't have trial data results, it's important that we spend more time setting the scene and letting them know the special source of the intervention or the context that it sits in, rather than just mentioning that we don't have trial data yet. There's more to an intervention than trial data.
Yeah, I think that's an important point, that it's also just the intervention and what we're trying to do, the evidence, why we're trying to get evidence around a certain issue, and in how we're innovating is already can already communicate well to create the demand, maybe, as you say. Okay, there's some issues we've covered a lot in terms of dissemination, what works, the challenges. We haven't really explored the question of to a bit, but the competing demands across sectors. So I'd just like to turn again to Dr. Fanai, and mixing first names and last names, and Rainier Merle, just to ask about in multi-partner projects, if you have different priorities, how do you keep everyone aligned, and what internal practices have been most effective in supporting collaboration across disciplines? So how do you, so as we were saying, different stakeholders, you might need different priorities across the different type of stakeholders you're trying to reach. So it's again probably this question around how do you prioritize, given that it's better to keep things simple, as we've been hearing and discussing too.
Yes, I said before, the Reconnected project is a project of 11 partners. So in this case, to maintain alignment in this project across diverse disciplines, we established a shared evidence-based conceptual framework to essentially guide all parallel work streams and to ensure participatory governance. Also, we created one centralized communication and dissemination plan by partner decided about this task with this work. Also, we to collaboration in a stable manner, we created one single point of reference, such as a shared point platform, which houses all guidelines and templates for consistency in our work. Additionally, keeping diverse teams aligned is done by highly structured schedules, including weekly, monthly, regular meetings, also cross-partner and cross-work packages task force, which alongside of multi-stakeholder panel maintains a continuous feedback loop across different countries.
So indeed, the discipline of having to develop a common strategy and just the project proposal planning process is very useful in this context. And Rainer, would you like to add anything?
Sure. Also being mindful of the time, so I'm just going to mention a few quick things. So with our project, MentBest, it basically runs across 5 European countries, right? So we have Estonia, which is up in the north, and then we have Spain, and we have Greece, and we have Albania and Ireland. So keeping everyone on the same page is, well, it's a constant effort. Well, we have of course, our pretty much catch-up sessions all the time to see where we all are at. But you also need to have like one very engaged person on the ground, a person who knows the landscape well, who can pick up the phone call and call the right people, and who can really jump on an opportunity when it shows up, right? So that's what happens locally. But here's the thing, well, when one person, they just kind of start to go freelancing as they see fit, because we are implementing one specific intervention. Obviously, we have to adapt because, well, implementing something in Estonia is a bit different than, for example, in Greece or in Spain. So you have to take, into your awareness the context in which you are working. But we have to kind of still implement the same intervention in all countries. So what basically I'm trying to say is, fine, adaptation up to a point is necessary and even I would say mandatory, but you have to track what you have changed and why, because everyone adapts locally. But if you don't write it down, then how do you in the end know if your intervention works, or just one-man army who did all the work and just freelanced and did whatever he wanted? That kind of made an impact, So basically, you cannot go off the script. You have to kind of check in all the time with your partners. And that's where regular project meetings and all kinds of tables and tools come into work. So, yeah.
Yeah, I think that's a very important point. We need to learn by doing, but then also really learn from it. So that means really capturing what's happening and why it is or isn't working in different contexts. Otherwise, that information is lost. Yeah. And a final question to panelists. Back to Dr. Laura Taylor, who I think we started with. Bring her back in at the end. And also very briefly, Dr. Habib Nassar, around the question of, are there audiences that you have not yet explored but would like to, and what has held you back? I do think we've heard this, the word simplicity is out there, but it would be interesting if you could reflect on what, if there are omissions out there that, given more time, more resources, what would you like to explore further in terms of really having an impact with the findings, in your case of ASP Belong, or the outputs of ASP Belong?
Yeah, so for ASP Belong, we have a ton of creative output. So we worked with a dynamic theater program, and they made incredible videos through the co-production with youth. So we just have a trove of really engaging content. And one of our hopes is to curate that into short video clips, maybe enter it into festivals to again, get outside of the traditional academic markets, because the young people speaking for our project does it better than any of us. And then in particular, we also really want to focus on public events. So seeing some of Dr. Pavla's work at the beginning, thinking about those broader in-person campaigns is something that is a take home from this so that folks can really see and play our game. So anytime we've done a workshop, if anyone ever uses our interface, they are immediately hooked. And we just need to figure out cool and creative ways to get people to be able to play our game. Yeah.
Great.
Thank you. I think, yes, in few words, in Smile, I think we didn't enough reach out policymakers. We think if we want to maximize the long-term impacts of our project, we should maybe, we see the importance of becoming, for example, more involved in roundtable task forces, joint action connected to policy driving or initiatives that can strengthen the link between the research outcomes and policy making process. So in other projects, I mean, in energy field, for example, are involved in some specific roundtable like Bridge, DeepSnet, and so on that facilitate to reach out policymakers.
Yeah. Thank you very much. I think we really heard a lot. I think there are two issues, but maybe if we go into the full panel, because I'm really conscious of time and I wanted to see if there are questions in the chat and if we can bring in the audience with some questions. But in the meantime, just throwing two questions, because two really important issues that we haven't discussed is that of how to assess whether something's working or not, the evaluation, whole topic in the areas of communication and research and impact, but also how do we ensure that that our efforts continue to be sustainable also once the project ends. I think that's in every project, that's a huge challenge. Portals have to be funded and die, or other outputs, that's just one kind of output, but you know, that is very important of how can we ensure sustainability of communication and dissemination efforts, that it continues. So exactly that. I'm just going to throw it out there, and if one of you would like to answer, that would be great. And I see Habib, your hand is up.
Yes, in Smile at the beginning, we asked ourselves the same question: how we can ensure, we can say, the long-term impacts and effective impacts beyond the project lifetime and the post-project. So what we did is develop EU tracker tool in order to develop it within Smile, and how it works. For example, during the project, you define your dissemination plan and your impact pathway. And at the post-project, we have an AI agent that will check these references in periodic way and will ensure the collection of the impact during, for example, 5-year post-project. And maybe some of you know this tool, but if some project want to use it, we are offering a free of charge services basic that can be along this post-impact maximization and monitoring.
That's a wonderful offer and a wonderful already outcome maybe of this particular dialogue, if anyone wants access to this tool. And as you say, I think sustainability is always something you have to think of at the very start, and too often it's left towards the end of a project. But it has to be embedded throughout a project as something that we've learned, and of course, all easier said than done, but it is very important. Is there anyone else who would like to answer this question around sustainability, how you are planning to ensure the sustainability, what you've already put in place, or just to say something about the evaluation? Laura?
Yeah, mine is actually a request. So this might have followed up to Habib's point as well. But right now we're in a phase where we're trying to reach out to industry partners. So essentially technology companies that could sponsor and maintain our app, because that's going to be the most expensive part of what we are doing in terms of just new system updates and those sorts of things. So we're actively trying to do that, kind of coming up with a business plan. But that's, I think, a growing edge for our team. And then I think the second thing that's kind of exciting is really thinking about when I see people have their hands up. So I'll stop there.
Wonderful, but that's so important. And as with Habib, having companies out there, it's and making that link to also the private. I think we tend to focus on the public, but of course, if we really there are things to put to market, that's the most effective thing. So I think that's, again, a whole topic with 10 minutes left. It could be the topic of a full discussion. here, and I see Rainer. Maybe I should ask, I don't see any questions popping up on my screen from the audience. So if there are questions, and then we can continue the discussion, use those final minutes that we have. But if there are questions from the audience, I'll also take those in mind. Rainer?
Yes, thanks. Just a quick, finding. I sincerely believe that if your implementation is good and it's well executed, whatever that would probably mean for each of the projects, you will see uptake more or less naturally. So from our project, I can see that we had an implementation. The area where we did implementation just covered a piece of Estonia, actually a piece of the capital. What has happened now after 1.5 years later is 5 different regions across Estonia has reached out to me and asked, we love what you're doing there. We would like to implement something like that in our region. How could we do that? So now you have actually quite a bit of leverage to go to, let's say, the local municipalities, or you can go to the state and say, listen, we have done this thing. It's actually kind of evidence-based. And now we see, interest from different regions. So I would just recommend, do your thing, do it really, really well. And then, you will see interest and uptake. Yeah.
Thank you. Well, good product. There is something to be said of just having a very good quality product out there and getting it out to the good targeting people to see it grow and snowball. Good. I didn't see which order hands came in, but I thought, Joyce, you had your hand, and Faith, you also had your hand up. So, Joyce.
Yeah, I could answer more. My point is actually a little bit similar to Rainer. We have had a lot of interest also from the local municipalities and organizations, and I think that's kind of like the exploitation part of it is the sustainability part of it is coming out naturally, but also through our co-creation activity. So that was really, really important. But also by design, just to share also that advanced exploitation strategy is around long-term institutions rather than the project alone, because we all, as Ingrid has mentioned, that projects end, but that the institutions and the networks can remain so that they can, host the products that we have. So for us in advance, the results will be continued to be disseminated through Mental Health Europe, who is part of the project, but also the World Health Organization, because they're, especially since most of the interventions that we're developing is through WHO. So a lot of our dissemination strategies are really geared towards how those institutions and networks will continue it after the project. So that's just to share.
Absolutely. And I think as these dialogues are set up to do, it's also through sharing and working with each other to see what's already out there instead of reinventing the wheel and building up on what we're all creating. That's also part of the aim of all of these dialogues, because there's so many, these partner projects, these calls do bring an enormous amount, as we can see from the panel, the expertise around the panel, and then layers of expertise all working on around the same things. So it's really also how we work together and are aware of what we're all doing. So that's great. Faith, you had?
Yeah, I would just like to speak very quickly about ownership, about sustainability. I think it's difficult not to talk about sustainability without thinking about ownership and what this actually means in the given context. We've heard from the other speakers today that obviously we're implementing across different pilot sites. So what sustainability looks like across the different sites can be quite different. And to mention the roundtables again that we've been working on for Improver, ultimately what we will get out of these roundtables is a roadmap which specifically looks at, okay, who's needed for ownership, who's needed for financing, who's needed for implementation, dissemination. This is the way that we've structured these. In the future will be called roadmaps. And what we're finding is that they are very different across our pilot sites. So there really isn't a one size fits all in terms of sustainability. We can't take what works for ownership in France to what works for ownership in Romania. They're quite literally reverse, we're finding. So yeah, I think my main takeaway in terms of sustainability is really like a tailored ownership plan that's built in co-creation with people who already exist in the given context. Because, as I don't know who is the best person to go for financing in Barcelona if I want to roll out an intervention. But what I do know is how to help the partners in the country find the right people through, mapping stakeholders and this sort of thing. So yeah, ultimately, I think it's about tailored solutions and working with the in-country colleagues to make it possible.
So again, going back to the local and tailored, targeted approaches and what works in different local areas. Great. Would anyone like to say anything around the evidence part and how you, Laura? Please do.
I think that this webinar demonstrates it. So you will have noticed behind the scenes, we have an incredible set of staff that both organized this and kind of made everything flow seamlessly. And they're asking polls, and those questions are the ones that we will help evaluate the efficacy of this type of webinar. So I think there's a ton to be said for doing data collection during all of these types of public dissemination events. So just an anecdote, we did a photo voice exhibit where we kind of share the images and voices from the young people. And before the exhibit, the audience who's just kind of in a general going to see an art exhibit takes a little pre-test. They go out, they take a little post-test. You can almost imagine those like smiley faces that you see at, public restrooms. And that kind of pre-post, we were able to show they endorsed in a higher way all of the aims that we had at the kind of heart of the project. So I think the aim is kind of always find ways to collect data in kind of cool and innovative ways that's very light touch for the audience members. So well done, conference organizers. Love seeing that in practice.
Yeah. I love that final answer. I think that says a lot. Again, just a sentence, find ways to collect data in ways that are light for audiences, but to use it and get the feedback and build on the feedback. Okay, I think we just have 4 minutes left. I think we've covered an enormous lot in terms of what we set out to do, identifying, sharing, learning on how dissemination priorities are identified, how you are engaging stakeholders, how to manage competing demands across sectors, what worked well, what challenges you encountered, what can be explored further. I am not going to summarize all the things that are now the buzzwords in my hand, but maybe we can just end with each of you just saying one thing that struck you. I mean, I think there's an enormous lot, but whether it was an example or from what another panelist said, and that can be kind of maybe our parting messages, because I think it's really been a great discussion, and I think we are all leaving with some new ideas or reinforcement of existing approaches and practices, but above all, realizing how important, I think, as was said, I think by Sophia during her intervention, this is really part of, and our keynote speaker starting off like this, it's a crucial part of any kind of research we're doing is the communication and dissemination component that really does take time and requires for fostering trust and relationships far beyond. So maybe very quickly, 3 minutes left, I will just call you Dr. Hubalkova. Maybe I'll start with you. What did you hear? Maybe just one sentence, and those can be our parting messages.
Yeah, enjoy it. Find a format and style that you like, and then it will be successful because you will have the energy, you will be creative, and it will work. So enjoy it. Enjoy it. Yeah. And please keep going. Thank you. It was my great pleasure.
Any kind of change, if it's fun, it's feasible. Well, thank you, Sophia. I'll go clockwise around my screen. Or counterclockwise.
For me, what really struck me was also the similarity, I would say, of the issues and facilitators that we all encountered, even though it was throughout different projects with that. Yeah. So yeah, I thought that was really interesting.
Great. Thank you. Naeem?
For me, it was a very, very good dialogue. And I think is one of the real examples how to go beyond academic circles, also this type of dialogue.
Thank you. Joyce?
Yes, what really resonated to me the most is what Sophia and Habib said, that dissemination and communication takes a lot of time and effort and resources, and this is also a problem within communication, and that it needs to be funded well also when you write your proposal. So that's just a reminder for all of us.
Absolutely. Thank you. Faith?
Yeah, I was reminded during the keynote speech that we're actually also consumers of communication. Like, I think a lot of my time is thought about what I'm putting out or working on, etc. And maybe there would be a benefit to me thinking of the ways that I'm consuming science education, because I think it happens subconsciously, like thinking about the elephant, etc. You see those sort of things in your city all the time, but actually thinking of taking note of them a bit more.
Very nice point. Rainer?
Yeah, so if anybody here, the listeners, you liked what I shared, or you would want to kind of work together, whatever, feel free to reach out via LinkedIn or just pop me an email. I love the session. Thank you so much.
And Habib?
Yes, I think maybe the main challenge is the engagement of stakeholders, and maybe they can be motivated, and why not rewarded? I mean, participant and end user. And thank you all panelists.
Thank you. And Laura?
Yeah, it's actually nice to end because I'm going to give a shout out to our keynote. Direct quote, science is not finished till it's communicated. That's my take home.
Wonderful. Perfect ending way to end this whole discussion. And as you said, and it's really all about the organization and so I think thank you for very interesting dialogue and discussions. And I think again that we really hit the aim. Thanks to all the people in the background that you're not seeing to help organize this webinar from ASP Belong. And they will be developing a report. So I think there was activity happening in the chat, so that can be integrated in there, and that way we can kind of get the overview of all the really great tips and learning from successes as well as challenges that we have faced. So around, it's not finished until we communicate. So thank you so much to everyone and our great panel. Bye-bye.